Good morning, everyone. Right, let's talk about the latest round of abject government incompetence. It has been announced in the Sunday Telegraph just today that Public Health England is described as failing, and it is going to be scrapped, and it's going to be replaced by a new institute modeled on the German Robert Koch Institute, which has led their pandemic response. And this scrapping and changeover is going to happen right now so that we're ready before any second wave or flare-ups or spikes. That is what is being claimed. Now, this raises red flags across a whole set of issues. So let's talk about distraction, blame game, questions of transparency, and questions of structure. Firstly, distraction. You never get an announcement like this briefed to the government's favorite paper on a Sunday when no one else has heard about this unless you want to distract from something. And this lands right slap bang in the middle of the A-levels fiasco that otherwise would have dominated the Sunday papers before the GCSE fiasco, which we know is coming right up. So first, straight out of the traps, you know that this isn't an honest, open communication from the government. It's a cynical ploy, and this is something with something dead important. Okay, so that's the distraction issue, that they would spring it right now, landing it on a Sunday through their favorite channel. Secondly, let's talk about blame game. We've known for a while that there's blame games brewing, and we've known for a while, those of us that have our ear to the ground on this, that Public Health England was likely to get it, was likely to have all the blame of the government decamped into Public Health England, and but we thought that was going to be further down the line. What's happened here is that the government have just decided to move fast on it and seemingly sort of quite randomly on it. But the reason is that clearly the government want to distract from themselves and all of their failings. Now, as it happens with Public Health England, it is under the direct control of the Secretary of State for Health. And the main problems with the response, or as Boris Johnson apparently has said, his anger at the sluggish response, is actually due to the government's slowness on this, and their slowness in communication about the threat, and their slowness to lock down. The biggest sluggish response has been at the governmental level, but they've decided to put it on Public Health England, which incidentally was introduced by the Health and Social Care Act of 2012 under the Tories, and yet Boris Johnson and his crew seem to be deflecting blame onto it and associating it with Jeremy Hunt, which is an interesting twist. So now that you see that dynamic, let's actually talk about the pragmatics of this. According to The Sun, this move, this transfer of putting together some of the best bits of Public Health England and the track and trace system, which they call the NHS track and trace system, it's really Serco, and that's how it should be branded. Putting that together, apparently Matt Hancock has been planning this for 3 months. In which case, why are we only hearing about it now? It seems to come out by executive fiat. If you were to be professional and open and responsible, you would have a review process ongoing whilst you're trying to handle the pandemic. If he started this back in May, why weren't we having open discussions within Parliament, across the select committees, with experts involved, about how we're performing as a system? What has happened with Public Health England is that we've been hearing rumbles from Tory ministers, usually unnamed Tory ministers, into the press slagging off Public Health England and prepping that. That is not an open and professional review on what is working and what isn't working. Now, we have called time and time again, plus other health experts have called time and time again, for a rapid, open public inquiry into how we're doing so that we can prep for winter. Boris Johnson has said repeatedly, yeah, there'll be time for lessons learned, but now is not the time. And yet they're already making changes, having discussed it with no one. What we did at March for Change is we worked with a bunch of MPs across all parties to set up an all-party parliamentary group on coronavirus and actually start running an inquiry whereby we've been listening from all the professional bodies, listening from the public, and making recommendations as we go through the summer into winter in order to talk about what needs to be restructured and how and why. That's how any competent government would do it. You know, the government would open up such a thing so that we can have that conversation, and the public then trust, and the professionals then trust, that everything is being done for the right reasons and everything is being discussed openly. Whereas this is an internal system sort of hijack by the powers that be. So that's the question of openness and process. Now let's go on to talk about the actual structure. So again, coming back to that thing that we heard from The Sun, that Matt Hancock has been planning this for 3 months, that takes us back to May, right? It was announced at the beginning of July that the Joint Biosecurity Centre would be leading up on all of these pandemic responsiveness tasks that now this new institute is meant to be leading on. So which is it, or how do they fit together? If they're both meant to be mapping out all the flare-ups around the country and providing all the dashboards and all that kind of stuff, which is it? Or does one fit within the other, or how does it work? We haven't had any answers on this because the whole process is secretive. But yet we're told already that this new centre, which mashes up Public Health England with the test and trace system, is likely to be headed by Dido Harding. So if you're saying Public Health England has failed, and we know that the test and trace system has failed, and it is headed by someone who failed in their previous job with talk on issues of data, you're now making a concatenation of failures, and you think that that is going to be world beating. I shit you not. They use phrases similar to that in the Telegraph, the Sunday Telegraph. And you're going to throw this together at rapid speed, and it's going to be ready for flare-ups going into the autumn. I think not. It sounds absolutely bizarre, and it sounds like just a system hijack. Why would Dido Harding, of all people, be tipped for the top job? This is clearly not an open process. It is a closed process. It is predetermined, and it is thoroughly unprofessional. And so, ladies and gentlemen, I present you with the government's most recent complete and utter catastrophe. And this comes on top of all of the other messes that they have made. There is no way that this government has shown any competence whatsoever in handling complex systems. So on top of everything they've screwed up with the test and trace so far, with their initial response, with the A-level results, with how they're handling Brexit, they're now doing a complete system reorganization on top of that in a completely opaque way, and they're changing horses midstream in the middle of a pandemic. Let me just tell you this, that the UK used to be the best in the world for pandemic preparedness. Like, we were the model that everyone looked at. But then Brexit came along, and because that distracted everyone and the eye was taken off the ball, the whole preparedness system just wasn't in place when it came along. That plus the genuine damage that that 2012 Health and Social Care Act did to the cohesion of the NHS and Public Health England and the Department of Health, plus an incompetent government, all meant that our overall response was then pathetic and sluggish. But the answer to it is not to just play musical chairs once again with all of their favorite people in an obscure and completely non-transparent way. It is to do the open process and open system. But this is the government that we have at the moment, and it's a damn shame, and it will cause more disasters down the line for sure. Thank you.